we help provider organizations reach those patients at scale, have a conversation, but what we're really good at is using AI scheduling to actually schedule and coordinate that patient where they need to in their language based on the preferences that they're used to. I'm Jerrod Ullah. I'm the founder and CEO of HealthTalk A.I. HealthTalk A.I is a bot technology that helps expand access for provider organizations. We do that in a myriad of different use cases, from expanding transitional care, keeping patients in network, to actually automating recall for patients in their language and scheduling them into our providers' EMRs. As a nurse, I have a clinical background and I was consulting, and I just felt like the fundamental problem of access was not being addressed. And I felt that we could simplify it for patients. And if we simplified it for patients, we would help provider organizations grow and be more sticky with their patients. Because we use a conversational bot technology, our engagement was 10x of a particular app engagement. So early on we knew the core thing was what we had to figure out was what were the problems that we're solving in terms of reimbursement, matching the reimbursement models to the engagement use cases. And that took some time to figure out. Yeah, one of the biggest engagement use cases right now is driving annual wellness. It's where providers actually uncover a lot of the illnesses that are percolating and that are happening within the patient. So there's a lot of models between value-based and otherwise that we help provider organizations reach those patients at scale, have a conversation, but what we're really good at is using AI scheduling to actually schedule and coordinate that patient where they need to in their language based on the preferences that they're used to. Yeah, I think there's a lot of buzz around AI. I think it's definitely helped us. I think as clinicians and as technologists, we kind of knew that there was going to be a space, but we've always thought about this layer of best practice or clinical practice of who should be doing the work, but now everybody kind of understands that there is a layer of AI or bot technology that humans are not good at or humans don't want to do. So it's definitely, that understanding has definitely helped us in terms of scaling and growth for sure. I think 2025 is really expanding to adjacent markets for us. We are really passionate about the FQHC space, also the rural health space, helping the most vulnerable patients get the care they need, using simple tools that are at your dry cleaner, right? If we can fundamentally take that and put it into those patients that need the care, it's going to be a great year.
I'm Joe Mansour. I'm the CEO of Allegiance Healthcare. We're a Louisiana-based healthcare system. We operate primarily in the rural space, which is the patient population that probably needs healthcare close to home more so than anybody. So our drive is to create quality care close to home, whether it's pre-hospital, hospital, post-hospital, or even end of life. How I was introduced to HealthTalk A.I. was in an effort to find ways to close the gaps on healthcare for those patients in that geography and that population, whether it's a Medicaid member or it's a Medicare or a commercial patient. And what HealthTalk has enabled us to do is to micro-target groups of patients that had not had access to care in the past, whether it's for a wellness visit and they have not seen their primary care provider in ever or in the last 24 months. We're able to micro-target those groups and get them access to the care. Mammography, colonoscopy, specialty care for orthopedics, neurology, all of the things that people historically thought they had to go to the big city to follow the shiny light to get that kind of care. We're bringing all that care back to home, and HealthTalk AI has afforded us the ability to contact those patients, communicate with those patients, and automate their access to care, which has eliminated the need to fill employee gaps that are almost impossible, decrease human error, and at the end of the day, make Louisiana a healthier state. So when we began our relationship with HealthTalk A.I., it was specific for difficult to reach patients. Again, those patients that had not been to see their primary care provider ever or within the last 24 months. So we micro-targeted that specific group using claims data from the payers compared to the data that we have in our AHR. And we were able to successfully reach those patients, but not only reach them, but encourage them by automating that scheduling to get them into our clinic and see the provider. And that's where the clock starts. Getting those folks that initial wellness visit is the benchmark of their relationship with their provider, and we were able to do that effectively with HealthTalk. Typically, we don't look at things as financial gain. However, that's how we stay solvent. So what HealthTalk has done for us from a financial perspective, the ROI is almost unimaginable. We're seeing patients that we would not have seen before. We're creating risk scores on them through the wellness visits that enable us to give them the proper level of care throughout the continuum over a period of time. So not only are we capturing those visits, but we're also decreasing the leakage and the outward migration of those patients that are attributed to our system into other markets. We've decreased unnecessary ER visits. We've shortened lengths of stay. We've attracted patients to our system that now will not leave. And so their families, the mothers, the children, the dads, the uncles, they're getting, again, as I said earlier, quality care close to home, and we're able to attract them and keep them utilizing HealthTalk A.I. I'm an analog man in a digital world, so anything technology related is seemingly complex to me. However, what HealthTalk has done is enabled me to have a result that was desired and to utilize it behind the curtain to achieve the results that we were looking for. So is it complex? For some people it is, the ones that are actually cowboy keyboarding, whatever you want to call it. But for me as an administrator and a CEO, I'm able to have a vision that I'm looking for results, share that vision with the HealthTalk AI team, and they put the rubber to the road and drive the results. If you look at Louisiana historically, Louisiana is ranked 50 out of 50 in healthcare, and that's not the top, it's the bottom. And so what really excites me is there are patients that have not had access to care that we're creating a relationship with their provider locally, and we're able to close those care gaps and create an ecosystem of healthcare for people that are what drives our state to be the lowest. Most importantly to us is we want to raise Louisiana out of the bottom, and the patients that have not seen their primary care provider are the most expensive patients to the state and to the federal government, and they're the least healthy. By proactively targeting them utilizing HealthTalk AI, we're not only able to save federal and state money by decreasing the expense of taking care of that patient, we're giving them a healthier life. And those patients are who are going to make our state a healthier state. If I were to try to summarize the relationship with HealthTalk AI, excuse me, and how it has been working with those guys, it has been extremely personable. They have been part of our team, part of our family. We're a small Louisiana operation in comparison to the national footprint, but at the same time we're fairly complex, and they were able to come in and integrate themselves into our team and to be part of our team and see our goal and see our vision and actively attack it with us. I think that being a healthcare provider is a huge driver behind Jerrod's mission, which hits home for us. My partner is a nurse. Most of our CEOs of our facilities are nurses. My mother's a nurse. I went to nursing school, but I decided I like finance more than patients and doctors, and here I am in healthcare. But I think that at the core, that's in somebody's DNA to take care of patients, and the fact that Jerrod and his team are smart and utilize today's technology to do so, that's where we are as a country.